With me now is Erin Willinger, and she is the Assistant Clinical Director for the Robert Alexander Center. Welcome in, Erin. Appreciate you coming.
Hi, thanks for having me.
Okay, for those who are not aware, if you would, just a little bit of overview of the Robert Alexander Center.
Okay, the Robert Alexander Center is a detox residential facility. We treat substance use disorder and co-occurring disorder. Personally, in my opinion, it's the best treatment around. We do a lot of things differently. We individualize the care. Our building is set up so that the detox and the residential is separate, so the people that are still sick and coming off, different substances and alcohol are separated from the people in residential. So, once they get better and their symptoms are relieved, then they move over to the residential side. There's just a lot of things that make Robert Alexander different.
You said something there that really caught my ear. You said you were talking about the different kinds of treatments. From what I understand, your treatments are evidence-based.
Yes.
So you know that you're going to get results, and it's all based on evidence. It's not any guesswork here.
Yep.
But yet you also said, Erin, personalized.
Right.
So tell me about evidence-based treatments and how you can personalize those.
Each person that comes in to treatment is suffering with different things. They have different disorders, different substances they use, different traumas, and we have a whole team of different individuals that meet with them. We have case management, we have therapists, you have a counselor, we have behavioral techs, we have nursing, there's medical, we have, just so you can have that comprehensive care to meet every need that an individual might be suffering from.
Let's talk a little bit about what you do, okay? Okay, so, to me it sounds like you talked about all these different services and treatments, so from the beginning to the end, it's not like you're going to let someone go and you're not going to stay in touch with them. This is long-term recovery that we're talking about here, and that's what everyone, of course, is interested in. So let's talk a little bit about that, what you do and how you help.
I am a person myself in long-term recovery. I've been sober from substances for 6 years. I suffered pretty intensely with alcoholism and drug addiction, and when I got sober, I knew this is what I would want to do with my life. So I became a clinical therapist, and what my role is to meet the client where they're at and provide therapy services to them.
So you can look at the Robert Alexander Center from different perspectives.
Yeah.
Not only as a professional, which you are, but also from the other side because you've been there before. I'm just curious, had you tried other methods before you went to the Robert Alexander Center? Did you try other methods?
I did not personally go to the Robert Alexander Center. I wish I would have. That is where this personal mission comes from. I tried everything. I went to all different centers. I've worked at other centers. When Robert Alexander opened, I was like, that's something that I want to be a part of. And just being that I had went to different treatment centers and never received the care that we give at Robert Alexander, I knew that that's the place that I wanted to be.
Interesting.
And just being, we have different, we have people that are in long-term recovery, we have people that are not, people that love people that have been addicts and alcoholics, and we all just kind of come together. And I just knew that that was my personal mission, to help somebody. When we're 18 years old and somebody says, what do you want to be when you grow up? I spent lots of dollars, and my parents would try to fix me, send me to different schools, and I never knew the answer. And so then when I got sober, I was like, I know what I want to be when I grow up.
Yeah, that's cool. It's a calling.
Yep, help people just like me.
There you go. Robert Alexander Center. Okay.